time to feed this little muffin. This little kitten still needs a bottle. When we use bottles, we tend to use bottles like this with what is called a miracle nipple. And this is a mini miracle nipple, which is the right size for most neonatal kittens. You need to specifically use kitten formula for kittens because that's incredibly important. Cow's milk is not appropriate. And you also want to make sure that it is nicely warm but not hot. Okay, so making formula is part of the critical care routine when you have kittens. This happens to be second step formula here for kittens that are 4 to 8 weeks old, but if you have the ability to, and you can find it, first step formula is probably a better thing to get because it has the more appropriate balance of nutrients for all kittens, and it will then last you through. The second step formula is great. There's nothing wrong with it, but often by this point kittens are weaning more and the first step formula has more calories and is better for them. When you are making this, you want to make sure two things. Look at how you're supposed to store kitten formula. Some kitten formulas ask that you keep them in the refrigerator and some are counter stable. You can also freeze extra formula, the powder, and keep it for up to 6 months. Inside each can, you're going to find a little scoop, and the little scoop is the measurement that you're going to want to use for making the formula up. And ideally, it's best to make up each formula bottle fresh, or at least make up no more than a day's worth of formula to keep in the refrigerator. So you use the ratio that's on the can, and typically the ratio is 1 flattened out scoop to 2 scoops of water. But you do want to specifically look at your personal can that you have to make sure that that is true. If you absolutely cannot find kitten formula where you are, canned goat's milk or fresh goat's milk in the refrigerated section is a viable trick, but not for the long term, and you want to get kittens on formulas absolutely as soon as possible. You want to mix this up with warm water because it helps dissolve the fat globules in it, and then when you are rewarming it, one of the safest ways to do is to take a mug, put some pretty warm or hot water in it, and then put the bottle down in it and let it set in there for about 5 minutes, and so that it becomes warm. And then, just like you see in the movies, test it on your wrist and make sure it's warm. You cannot feed cool or cold milk to kittens. It is it causes serious problems and even can be deadly to them. So that's incredibly important. Kittens are never fed on their backs like we would a human baby. Kittens are always in a down position or slightly upwards again, but never on their back. So some kittens are very easy to feed and some are more difficult. This one tends to be a little bit more easy to feed, but with persistence, most any kitten will learn to take a bottle. One of the things you want to make sure is that you're not squeezing the bottle, because a bottle can spray milk like that and it can spray it down their throats, and that can make them choke and aspirate, and that is not good. Oh, you taste that milk down there on the blankie. So you want to make sure that you're putting it in their mouth. You want to make sure that there's actually a little bit of milk on the tip of the bottle so they get a taste of it, but that you're not spraying it into their mouth. So we're going to take Kitten right here. We're going to put it close to their mouth, and this kitten is unusually easy to get to the bottle. Can you hear that sucking motion? What you're going to do is you're going to start seeing bubbles come up in the bottle. You will see, depending on the kitten, you'll see this kitten has what I would call subtle ear wiggles. Some kittens have very, very pronounced ear wiggles when they are bottle feeding, but they relax a little bit and then they suck on the bottle. It usually doesn't take all that long. That was actually an incredibly short feed because this kitten actually ate a little bit earlier. But sometimes you're going to see this. They're going to try to chew at the bottle. Sometimes that's when they're getting older and getting ready to wean. This kitten actually has a couple teeth, and so they are kind of testing those out. You want to be very sure and check on your bottle each time, and I'm going to show you how to do that after we go back in for a little bit of second breakfast here. Like that. But before you feed, most of the times you want to make sure that this nipple is still in good condition by taking and pulling at it to make sure that the rubber is still in good condition and no little pieces are going to pop off. And then it doesn't really take that long to make sure that Kitten is getting enough food. You're either going to mark the bottle ahead of time, or you're going to weigh Kitten before and after to make sure they have gotten in the appropriate amount of milk per their size. And there are charts to refer to for that, because each kitten at different sizes is in need of different amounts of formula. So some kittens are problematic to feed because they're all paws and they're all wiggle. And it's not their fault, because they are trying to learn something new as well. But one of the things that you can do is that you can take a little blanket and do what we call a burrito. And that is when you take the kitten and then you wrap it up in a blanket like this, so that their little paws are contained and that you have a little bit better. Now this kitten's already fed quite a bit, so it's not very interested in doing this, but by doing the burrito method, you have a little bit more control over Kitten. You never want it to be too tight. You just want it to be in a way that's easier to get a grip on the kitten, and then also help direct their face, because sometimes they can like wave their face around a little bit, and then they'll try to get their little paws out like that. But if they're wrapped up, then you can just dealing with their faces this way. And sometimes that means putting your fingers on either side of their face to help direct which way they put their attention to the bottle. So bottle feeding kind of works on a schedule, very much like babies do. And when they are very young, newborn to about 2 weeks, we start on a schedule of every 2 hours around the clock, and then we adjust from there, going out longer and longer depending on how the kitten is doing. The scale is always going to tell the tale when you are talking about neonatal kittens. Kittens need to gain somewhere between 10 and 15 grams every day. And if they are not gaining an appropriate amount, you need to look into what's going on for them. Either they have something going on intestinally, maybe parasites, maybe they're not getting bottle fed enough. And you also want to make sure that you are mixing up their formula in the correct ratio, because a thinned out formula means that they are not getting enough calories, and a formula that's not mixed up really well, like has chunks or stuff in it, and that go to the bottom of the bottle, means that the fatty deposits in the formula are not being ingested by the kitten, and they're being left in the bottle. So you just want to make sure that they are getting the appropriate amount for their age, starting at every 2 hours, quickly going to every 3 and 4, with longer gaps overnight to let them sleep. But again, if they gain that requisite 10 to 15 grams a day, you are on the right track. All right, so the last stage in the feeding is making sure that the kittens are able to void, and it means that they are urinating and defecating. A kitten will not necessarily poop with each feeding, but they should urinate with each feeding. You can use some very soft cloth, you can use baby wipes, you can use toilet paper, anything that works best for you or that you have around. Each person who fosters kittens does it a little bit differently. Some people do roll their kittens onto their back and wipe them this way, but it tends to be a little bit messy. So I actually hold my kittens down like this, and then you gently rub them, and then you will feel that whatever you're using, the towel, the wet wipe, whatever, it'll start getting warm because they're peeing. And you give them a minute to do that. And sometimes they will make a lot of noise, the same way they would if Mama Kitten was cleaning them, because we're doing Mama Cat duty here. And so, like I said, not every time will a kitten defecate, but by stimulating them to urinate, that will also stimulate them to defecate. So they will poop at least 1 time a day. If they are not pooping 1 time a day, that is definitely a time to reach out for veterinary care and help, because it means that they might be constipated. We do this for them because they don't have a mama cat. Mama cats do this for their kittens for up to 6 to 8 weeks, taking care of them in this way because they are not able to eliminate on their own. So typically kittens start the weaning process when they're 3 weeks old. They start getting teeth in, and that doesn't mean that the bottle goes away directly. That means that you just start offering a little bit of wet kitten food at that point. Some kittens take to wet kitten food immediately, and others take a great deal more time. So somewhere ideally between that 3 and 6 week period, there's more kitten food, less bottle, until by the end of 6 weeks the kittens are no longer having any bottle and they are totally dish fed at that point. Thanks for coming and learning about how to bottle feed kittens, and like and subscribe to our channel for more information on these topics.